Welcome everyone to Naked Aging, and we're all here as usual. We have Buffy, Dr. Miles, psychiatrist in residence, and we have Celia, of course, and Francine, and a very special guest with us today, Dr. Stephen Hopping, the renowned Dr. Stephen Hopping, plastic surgeon here in Washington, D.C. for many years. I covered your work as a journalist, and we're always happy to see you and have you answer our questions, but we all have some very personal questions that we'd like to ask you. Speaking for women of our age, that certain age, can you look at us and tell how old we are?
No,
don't tell
probably
us.
not. Probably not.
Don't try.
It's about, everybody gets a little bit too focused on, their 10x mirrors. What's really beautiful is the energy your faces have, And sure, if you have wrinkles or if you have bags, that sort of detracts from the energy. But it's the energy that people are attracted to, don't you think?
I sure hope so.
Huh?
I hope so. You got it right.
These ladies all have wonderful energy.
Yeah.
Well, I think that is true, and I agree, because I like friends. I choose my friends that way. But I know we all have questions that we want to ask you about what
I
we
have
can
one.
do.
No.
Yes.
Are you ever too old to have plastic surgery?
Well, I think that's a
That was the
really,
first
really
question.
good question. Those of us of this ilk, of this age, and we're all part of that baby boomer generation. And, baby boomers they're still the CEOs. They're the presidents of the United States. They're the ones who are, out there still dating. They've gone through, on their second, third marriage, and they're out there. They're not ready just to go into a home. They're living, they're working, so they want to look the part. They're working out. So I think that baby boomer generation is the one who's really skyrocketed with it.
When you say
cosmetic and plastic
baby boomer,
surgery.
what age group are you really speaking
Well,
of?
it would be 85 to 60.
Oh, okay. I'm in
Okay.
that. Okay.
Yeah.
That fits us.
She always worries
60 and
about
up, yeah.
who's a baby boomer and who isn't. But listen,
And the other thing is that people are, they're more conscious about their health. I mean, my father's father died when he was 50. My father was very conscious about his health. He died when he was 82. And, the generations are... So I think that it's about the way people want to feel. They want to always feel attractive, and they want to feel virile and...
So if an
shape.
80-year-old comes into you and says they want to do your face, they want you to do their face
Uh-huh.
or something. What about being put under, anesthetized?
Well, the first thing I ask them is, number one, have you had any previous plastic cosmetic surgery?
You can't tell?
Usually I can,
Yeah.
but we need to know. Maybe there's something I didn't know. Do they have
He's
cheek
interacting
implants?
with the patient.
Do they have
Yeah.
cheek implants? Do they have chin implants? Those are things that are hard to tell.
So far,
so
that's
you
no
first thing
for
you
two.
ask is,
Okay.
have you had any other surgery? Are you
Right.
talking plastic surgery, or suppose
Yeah.
you've had a hip replacement or something else?
Knee replacements, all that.
Broad strokes, we want to know all of those things. Really, the most important question for me is, what medications are you taking? Are you on a blood thinner? Because if you're on a blood thinner, probably
Not.
you're not going to be a good candidate for elective surgery, because your medical doctor's not going to give you a clearance, and rightly so.
Right.
If you're on high blood pressure medicine, is it controlled? That's okay if it's controlled. Do you have stents in your heart? Have you had a heart attack? Because if that's the case, I'm not going to do you in my office. I'll have to take you to George Washington University Hospital. So it becomes a whole bigger deal. Now, nobody goes to either my operating room or GW's operating room without medical clearance, okay? Probably we should have them all get psychological clearance too. And sometimes I do that. Sometimes I will do that.
Well, the question, of course, from the psychological point of view, would be, why now?
Right.
What are you doing? How do you feel that your face is or isn't presenting you the way you want to be presented? Because our faces are our PR. And so when you walk into a room, you have 30 seconds to make a good impression. And not 30 minutes, 30 seconds.
Exactly.
And I don't care how old you are. You can be 25, you have 30 seconds. That's why I have these hilarious conversations with my adolescents because, you know, they're doing all kinds of things right now. They have the mushroom explosion hairdos and so forth. So you're not going to get the job, you know. And they say, but Dr. Miles, I'm smart and I can do this. I said, yeah, but your PR isn't good.
The PR is the way
Yeah.
you look.
The PR is your face first.
Yeah, well,
And-
Don't you think that in this generation, we can use baby boomers, that do you find yourself having to manage expectations? If you're seeing a woman who wants, get rid of her wrinkles and a facelift, and do you try to tell her what is doable that will keep her looking like herself?
Mm-hmm. Sure.
Versus, and the reason I say that is I can remember, say even 15 years ago, when you were talking about energy, when facial fillers and Botox had made so many women look sort of just plastic.
All right.
And so
it's
you
still
didn't-
happening.
does that mean
They
they,
can't smile.
does that mean they've had too much?
Usually that's too much, yes.
Right, right.
Like-
So, but that's a couple questions. So.
Sure, no, but because, how did we want to look? We want to look like we did when we were younger, maybe a little better. If we had a weak chin, you add a chin or something of that nature because that always helps. But with fillers or with surgery, if it doesn't look natural, then it looks a little weird. It looks a little bizarre, it's off, and that's not attractive. And we've made this mistake by pulling facelifts too tight in the past, and we don't do that anymore because what part of aging is gravity, but part of it is atrophy. We lose volume. Look at our children, and you have a lot of volume still, but that's good. That's why you look so young. But the rest of us tend to lose volume. Okay, so that's the
Stab
whole
my heart.
that's the whole filler market, adding volume, and boom, you look younger.
Yeah.
But if you had too much volume, you look like a caricature.
You
You won't look like a
Or
caricature.
like, you're right, the first facelifts, everybody looks surprised.
Right.
And then there's also the...
Or like
big
they're on a
lips.
on a wind
Yeah.
tunnel,
Yeah, right, exactly. And then the whole thing with big lips.
Do you think people realize that first things go forward and then down? They don't. So if they're going to be fixed, they have to go up and then back.
Sure.
So
Well, and by first adding volume, either with fillers or we're using patients' own fat,
yeah,
almost routinely, because we add more volume, and then, as you say, there's less lifting and less looking like you're on a wind tunnel or
Exactly.
on a bobsled,
But how long does the fat last? I mean, when you say inject fat,
Mm-hmm.
does that last any length of time?
60% of the fat has longevity, not 100%. So it's something that sometimes you have to do again, or you do. My patients who've had facelifts as a maintenance, many times come every 6 months and do their Botox and do their filler as a maintenance.
so is one of your first questions, what do you want from surgery?
Mm-hmm. Sure, of course.
And what kinds of answers do you get?
A lot of times, most people come in who are over 60, okay? Now, many people come in and, they've had previous plastic surgery and maybe they had something when they were 50. With aging, what happens as we approach 60, either our eyes or our necks that seem to age faster than the rest of our faces. If you've got really good bone structure, like Barbara here, those cheeks, great cheeks, that tends to slow the aging process in this area. But the neck, you see, our necks don't have the same elasticity as the face, so they always age faster. So the necks usually have to get done first, and maybe the eyes. Eyes, fortunately, people do generally once a lifetime. You don't have to do it again. Necks, probably you have to do a tuck up in 10 years.
How
Have you
hard
ever
is it
had
to
any
do a
money?
neck? How hard is it to,
A neck is it's a similar kind of recovery to a facelift. A facelift is a misnomer. It's really about the neck and the jowls.
Well, I was
We call it a facelift, but it's really, what it improves the most is the neck and the jowls, the lower face.
I was saying to Steve that about, 8 or 9 years ago, I inherited the biggest turkey waddle. I mean, it was so much skin here.
Pronounced.
and it made me look, and I have bony collarbones anyway, and it just was so aging looking.
Yeah.
And having that fixed really helped. For me, my own, I don't know,
Your
I guess it looks
self-esteem,
better,
everything.
but it made me feel better about myself, and in a way, I think cosmetic. Not as much. We don't really use plastic surgery. Don't we use cosmetic? Cosmetic surgery is all about how you feel when you walk out the door,
Sure.
and that to me made me feel better. And the other thing, and then I'll stop confessing, is on my father's side of the family, we called them the brim bags, and there were these big eye bags that came, and no matter how much makeup, no matter how much sleep, there was no
You
way.
always look tired.
I always looked
Right.
tired, right?
And you
so
could not get rid of them.
I did get rid of them.
No, but I mean without some intervention.
Oh no, there was no way.
No way to get rid of them.
No, there was no like.
You can put only so
magic-
much white stuff under here.
No, you could not get rid of it. It's like the turkey wallet. Those were the two major things that I think
Sure.
You know,
of. And
let
I
me-
don't, women come to you for that sort of.
Oh yeah, and you're saying, well, what do they come for? They know they're looking in the mirrors and they can't cover this tired look. They sleep all night. They go to an event, and people, oh, you're so tired looking. And no, they don't want to hear that. They try preparation H, everything, on their eyes. It just doesn't
Did
work.
that work? Does that
Works-
work at
Works a
all?
little bit.
That's it.
You didn't hear it from me. Off label.
No, no.
Most of the women that I know
I've
want
known
to be
people with
refreshed.
much younger.
Refreshed, and they don't want to look
be
tired.
refreshed.
So that's, I think, eyes, both men and women, is everybody eventually probably could benefit from eye lift. There are a
But
few
do you
people.
get more men coming in now?
Yes.
Many more men, yes. I would say still it's 60%, maybe 70% women, 30%.
But still, that's a
But
big
10 years
percentage.
ago it was 15%.
Yeah.
Right.
And in terms of your question about expectations, I mean, that's really important, You have to really be a little bit of a psychologist, understand what people are, or why are you doing this now? Now, many people in this age group, my age group, your age group, the group we're speaking of, their daughters or their sons are getting married. And
Yeah.
that's the impetus. They want to look as good as the new mother-in-law.
That's really interesting.
It's really true.
Yes.
And it does seem to be the case, too.
I usually ask that, and they say, yes. I said, when is it?
Big event.
Big event. And if it's 3 weeks away, I said, we better go the filler route. So we fill, we do Botox, we do some lasers, and we can improve them. We can't really give them, if they give us 3 months so that they
That's
look really
different.
natural, we can make a big difference. For the photography sessions.
What about the weight loss effect on getting ready for plastic surgery?
Well, what kind of plastic surgery?
Any kind. I mean,
Well,
I think
well,
that
face,
some
If you do
people
body.
are.
cosmetic, if you do cosmetic and you lose a lot of weight,
Well, I noticed that a number of people need to lose probably 20 pounds or something
Sure.
before they enter the process
Mhm.
because it affects their faces, it affects their waddles, it affects everything, and they're not necessarily doing
Did you say
body
waddle?
surgery.
yeah.
Waddle, right?
That's the waddle.
Oh,
It's
I
a
didn't know
piece of
that.
skin.
Is that the medical term for this?
It's Celia's
That's
term.
a sociological term. Waddle.
Yeah.
And-
yeah.
And,
that'd be
and waddles, you correct me if I'm wrong, waddles are hereditary. Because you look at people's family pictures, grandpa has a waddle, and grandmother has a waddle, or whatever.
Right. All the brims on my father's side had waddles.
Yeah,
you know.
And so you can expect to have one yourself if they did, or they have the eye bags, or
Sure.
Right.
whatever.
Yeah, no, of course. And, a lot of patients come in and they say, what's the best thing I can do earlier in life, in earlier ages, and to look the best I can, Dr. Hopping? I say, choose your parents carefully. But we don't have that ability, so,
Yeah.
but in your question about weight, I think it's very important, because number one, if you're 20 pounds overweight, it's going to affect your blood pressure. It's going to affect your general health. If you're going to do liposuction, if patients are willing, if they're under 5, 6, or 7 and weighing over 200, 220 pounds, we make them come down to 200 before we have it. We'll do that surgery. It affects your recovery from the anesthesia and from the stress of the surgery. Liposuction, we're sucking most of the fat away. But if you've lost weight, then probably you're going to need a tummy tuck rather than just liposuction. With facelifts, we do liposuction, so we suck this fat away first.
Yeah.
So it's less important, but it's good. It's good for their general health to get people close to
Even
their
if
ideal.
you suck
So
the fat
their,
away,
their
does
BMI
it leave
is
the skin
normal.
loose is a question.
Yeah.
So,
Well, if we suck it away, you can. There are lasers that we use internally that can tighten the skin. The new thing is the thread lifts. That, again, there's a limit that they can do, but they can lift the neck, the face. I love them. They're great. There's no anesthesia, or there's local
But you've
anesthesia.
been doing that. Okay.
Yeah, I do it.
But I
again,
I could
it's
see
for younger.
The strings. I could see the strings
I
for
don't
a
think
while.
that they just weren't done right. That's not really a problem.
I did see it on someone, and,
Yeah.
and
Well,
I
they-
saw the string, and I
Well,
went,
they can
oh
they
my
can be easily
God.
removed.
You can
If you
pull
do
this-
it, you can take it out just like you put it in, and they do dissolve. They're just suture material. They only last a couple of years, and it's really better for people early in the aging process. When you're really very loose, or you've never had anything done, you're 65 or certainly 70. You really need to have surgery. Otherwise, you're going to get like a 5% improvement. You're not going to see a difference.
Do you
And-
ever tell anyone no?
Oh yeah, and that's the hardest thing.
Yeah.
Telling people no.
For what reasons?
Their health, that they think that they're 65, 70, and they've got triple chin, and they think they need a thread lift. It's
Yeah.
just unrealistic expectations. So my job, or our job, is to get the patient's expectations and what we can really deliver as close to possible. Otherwise, they're going to be unhappy. They're going to need something else. They feel like they wasted their money, and they say bad things about you, so you don't want to do that.
So you don't think that there's anyone that's ever too old?
Oh yes, absolutely. But I will say that I'm doing, every week or every 2 weeks, someone who's in their 80s, but they've been cleared surgically.
Right.
They have no systemic medical issues, and we're using lighter anesthesia now. We used to
And
do only
Valium, not Valium, but
Xanax.
something. Xanax.
And we do it in the office, and we don't spend as much time. It used to be some people take 6 to 8 hours, but we've got it down to like 3. So you're on the table less. So all these things are important.
what about tummy tucks and butt lifts?
Ah,
Do you see those in women of a certain age?
We
do
certainly
you-
did.
no, that tends to be a younger
The Brazilian
group.
butt
The
lift.
Brazilian butt lift is the fastest growing procedure out there right now. Unfortunately, it's one of the most dangerous.
Really?
There have been deaths from the Brazilian butt lift. Deaths in every state of the United States.
Why?
Because you're taking fat. So it's great. You take the fat, you inject it into the butt. Sounds easy. There are these huge blood vessels in the buttocks. And if you if you get into that blood vessel, boom, to the heart.
Well, I knew that wasn't something I wanted to
I think a Brazilian butt lift is in none of our
do. Yeah.
horizons.
But a
But
lot
it
of
is
them-
very popular, and what's kind of nice, I just came back, I was in Miami Beach, and walking on the beach, and, everybody, certainly the beautifully thin
They're all wearing
patients,
those thong bathing suits.
wear thongs. And even patients who are quite,
Robust.
robust or have a
That's
lot of
right.
curves,
Rubenesque.
Rubenesque have a lot of curves, they're wearing the same bathing suits. Because why? Because of the Kardashians, and
Right,
because of the Brazilian butt lift.
right.
You don't have to, there's no shaming anymore. They're proud of those bodies. And I think that's really beautiful. It's changed. It used to be in the Twiggy period,
Everybody.
was
That
was
was more
cachectic.
Anorexic.
Anorexic, exactly. But now,
Now,
That's
Thanks
what
to-
I wanted to
Figure-
be. I mean, that's what we
Well,
were brought
it's
up with.
it's great for
And-
somebody who's born with
right,
a butt.
because a lot of people genetically, these patients are never going to be thin.
But what about those women who are born with flat butts? I mean, who don't have anything, and they
Well,
feel
there's
like
the butt implant, just like a breast implant. They have no fat, so you have to put it in an implant.
I
So
see.
That's
But
even a
you say-
little more complicated.
I
So
see.
is that that's worse than doing the injectables?
A lot of times they're combining, because there's only so much fat a lot of people have to put into the butt, right? A little more junk in the trunk.
Right.
procedure. So you put the
I
best.
remember when we used to have girdles to not show a
Right.
big
Yeah, I was gonna say, we've gone
I really think that's what the Kardashians do
Yeah.
anyway, because
Much
Kim
better.
Kardashian now,
Right.
she had that huge derriere, and now it's disappeared. Where'd it go? She's
Right.
got a new boyfriend.
Remember
That's what
that
happened.
that one where the picture in was it Vogue or Vanity Fair where she's balancing a cup of coffee on her butt.
Iman,
Some
the
people can
model.
put a tray
Kim
on it.
Kardashian.
Oh, because I think I saw
So
one.
the cover of
on
it
the
was.
model.
I mean, it was huge. It did disappear. It did go. I have another question. You were mentioning you were in Miami and on the beach. I mean, I'm of the generation where I spent my teens with tinfoil in the summer, tinfoil, baby oil, every day out there.
Iodine in the
I-
baby.
Yes,
Fine.
right.
Baby oil and iodine,
All right.
frying my body, but most of all my face, for years and years and years.
And
And then I was the same generation that didn't
We didn't
allow
too.
my
I
kids
didn't use that.
out, without sunscreen.
lathering.
And my children, my grandchildren, are lathered up. They can't, it's ridiculous. And it's almost overkill. So my question to you is,
sunblock.
women over 60 who have spent those years abusing their skin because of sun, what do you do when they come to you and say, I have brown age spots and
Excuse me, I went to the University of Miami. I don't have these for nothing.
Me too.
I didn't get A's and B's, but I got a great burn.
Well, but I bet you're wearing sunblock now.
You bet.
Sure.
Me too.
No, not so much. Okay, because the new
I don't
the
go
younger
out in the
gen,
sun.
the X and they're being very careful
They're-
about that. They know all about
Yeah.
they're into sunblock, and they're not into burning, and so they seem to be much more aware of it. They're that younger generation. The moment they have a wrinkle, boom, they're in getting Botox. They get fillers, and for the blemishes. There's a whole host of lasers out there. So these are all the non-surgical things that we were talking about that have, the incidence of people using these Botox and fillers and lasers, these non-surgical things, has skyrocketed, tenfold, almost 50-fold over the past 10 years.
Well, what I've been hearing now, that dentists are doing Botox on people. What is this crap?
mhm.
Really? Where do you come up that a dentist can give you Botox?
Because
Well,
everybody's
it's-
trying to
people
jump
go
on
to
the
them.
bandwagon.
Yes. Well,
Sure.
what